Hey, everybody, and welcome to the Senior Network. It's a virtual program of senior resources for seniors and caregivers to learn more about what it means to be healthy and independent. I'm Andrew Boozer. I'm the Executive Director at Senior Resources here in Columbia, South Carolina, where our mission is to help seniors be healthy and independent so that they can age in dignity at home. And that's what the Senior Network is all about. It's programs like this one, as well as our more traditional programs like Meals on Wheels and our senior centers, transportation, a whole array of services that are all designed on keeping seniors in their home and healthy. And today we were really excited to learn about Medicare. Part of being healthy and aging at home is knowing how to be covered for your medical needs. And Medicare it's certainly a timely conversation right now, and we're really excited to bring it to you on this edition of the Senior Network. I'm no Medicare expert, but luckily we've got a great friend who is. Joel Lourie is joining us today. Joel is the president of Lourie Life and Health, and we're really excited to have him back on the Senior Network today to talk a little more about Medicare. Joel is a familiar face around Columbia who has been a native here and out and about in the community. You can see him definitely at a Carolina basketball game. I've even seen him at a brewery from time to time. So
it's possible.
But we're really thankful to have Joel here with us today, and also for Lourie Life and Health for all the support over the last year for the Senior Network and for all the content we've been able to bring to seniors in our community and around the state. You may also know that Joel served in the State House for 18 years, and we certainly thank Joel for his time there, where he was a great advocate for seniors and looking out for families in our community. So, Joel, thank you for your service to the state of South Carolina and for helping out here on the Senior Network today. Welcome.
Andrew, it's a pleasure to be here. And I just want to thank you and your great team at Senior Resources for all you do. I've been both a fan and an advocate, probably for over 25 years now. And, y'all play such an important role for our aging community here in the Midlands. And there's so many wonderful services that you provide, from Meals on Wheels to educational programs like this, that I'm just really proud that our company can be associated with y'all.
Awesome. Well, thank you. Well, we're going to jump right in. So, Joel, as I said earlier, I know Medicare is very important. I see the commercials. I saw your billboard this morning on my way to work. So I know that you and your colleagues there at Lourie Life and Health know all is about Medicare. So let's just jump in real quick. But I guess the first question that I hear a lot of is, who is eligible for Medicare?
Great question. And I'm glad you made it to work safely after seeing my billboard. It can cause people to crash. But people that are eligible for Medicare, anyone over the age 65 or older is eligible for Medicare, as well as some people that are under 65 that have been on disability for 24 months. Now, Andrew, that doesn't mean you have to join Medicare at age 65. Today, we have so many people that are working into their 70s and even early 80s. And as long as they have group coverage, credible coverage, particularly with a larger group, 20 or more, the group would become the primary payer for their claims. If they work for a small group under 20, or they're retired and they have other forms of, say, health insurance through the marketplace, and they turn 65, then they would want to go ahead and sign up for Medicare. And it's usually best to do that a few months in advance.
All right. So when I'm turning 65, my birthday's in January. So if I were turning 65 this January, so when do I need to start thinking about that?
You can sign up for Medicare. If your birthday's in January, your start date is going to be January 1st. Okay. So the last day you'll be covered under your other insurance is December 31st. We usually like to get people in the office 90 days before they go on Medicare for a couple of reasons. Number one, we want to help them enroll in Medicare. There's a misconception that you automatically get a Medicare card in the mail, and that's really not true. The only time you'll automatically get a Medicare card in the mail is if you're drawing Social Security. So if you're not drawing Social Security and you've delayed that beyond your 65th birthday, we actually have to assist you, or many people do it on their own, going into the Social Security website and applying for Medicare benefits, but not, extending that application to include retirement benefits unless that's what they want to do. So that can be a little tricky. We do that. We don't charge for that. And we want to make sure we get people enrolled properly. Then sometime after you get your Medicare card, Andrew, because your Medicare is going to start January the 1st, only because you have a January birthday, not to be confused with this enrollment period that we'll talk about in a few minutes. But let's assume your birthday was June. All right, so we're going to want to get you in the office, make sure you apply for Medicare around March or April. Then when you get that Medicare card in the mail, that's when we want to sit down and make sure you fully understand what comes with what we call traditional A and B Medicare and what your other options would be to give you more coverage than just regular A and B Medicare.
Awesome. So when your birthday is coming up, if you're turning 65, start thinking ahead 2 or 3 months, and that'll really put you ahead of the curve so you can learn more about it, about what you need exactly for your situation. I got you.
Exactly.
Yeah. So you mentioned it just a second ago, but I know now is a really important time because open enrollment is there. So tell us a little bit about open enrollment and why that's important for seniors and for families in our community.
Absolutely. So it's called the Medicare annual enrollment period. It's the Medicare annual enrollment period, and it starts on October 15th and it runs till December the 7th. This is the time frame where people can make 2 changes to Medicare. Number one, if they're on what's called a Medicare Part D plan. Somebody might be on a Medicare Part D plan. If they have a Medicare supplement plan, they would also need a Part D plan. This is the one time of the year that they can make a change to that Part D plan. You can't just change your drug plan throughout the year. Once you sign up for your Part D plan, anytime from October the 15th to December the 7th, you're enrolled in that plan for the next 12 months. Okay. Now, if somebody is happy with their Part D plan, they don't need to do anything. It's also the one time of the year that people can change their Medicare Advantage plan. Medicare Advantage has become very popular. It was created during the Bush administration under a piece of legislation called the Medicare Modernization Act, but it's where insurance companies basically serve as the administrator for your Medicare benefits, and they're typically known as all-in-one Medicare plans. So you'll see a lot of people on TV talking about all-in-one Medicare plans. A lot of former football players, let's just say that they probably know a lot more about football than they do Medicare, but that's a whole nother subject. But we talk about all-in-one Medicare plans. These plans have become very, very popular, Andrew, because they can provide your A and B coverage. They give you co-pays for doctor's visits. Usually they include things like prescription drugs, maybe some dental, maybe some vision, and they become very, very popular. So during the Medicare annual enrollment period, if you have either a Part D plan, a standalone drug plan, or a Medicare Advantage plan, also known as Part C, also known as all-in-one Medicare plan, this is the one time of the year that you can make a change and come out of one plan and go into another. Why would somebody want to do that? It could be that a doctor is no longer accepting that plan. It could be that a prescription drug which was once covered is no longer covered. There are different reasons why people change plans. And what we try to do and encourage our agents throughout the state to do, Andrew, is sit down and do a review. Doesn't cost a dime. Sit down and do a review and then see if it makes sense for somebody to change plans. And, I'd say, half the time, or probably 65% of the time, all we really do is reassure them that they're in the plan that meets their needs and budgets. Sometimes we can find a way to cover their prescription drugs in a less expensive manner. Sometimes we can find a plan that might cover doctors or hospitals that aren't being covered by their current plan. So it's not a bad idea to review this. I don't know that you need to review it every year, but every few years, it's a good idea to have what we call a Medicare checkup.
Yeah, so just like going to the doctor to get your checkup on a doctor, I think, from what I've always heard, especially if you have some life changes or it's been a few years, it's a good time of year right now to go check in with Joel and his team to check in on your Medicare to make sure you've got the right plan. I know these plans change a lot. Senior Resources actually participates in one of those Advantage plans that provides meals when you come out of the hospital as one of the services. And so a lot of these Advantage plans are really starting to shift and change throughout the years. And so I think that's another great example on how depending on what your expectations are and what your needs are at home, that the Advantage plans may be a solution opposed to the traditional Medicare, the Part A, B, and D. If I got my alphabet soup right, Joel.
Yeah. One thing I would say is there's no bad decision. The two real options that people have to consider on Medicare. Option one is what's called Medicare with a supplement and a drug plan. All right, that can be the most expensive up front, but it's the most comprehensive. Okay. Option two would be what you were just describing as the Medicare Advantage plan or the all-in-one Medicare plan. That plan is going to have a very low monthly premium. Most of them are zero, but you pay copays as you use services. Okay. So there's no bad decision. I think the only wrong decision a client could really make is not to have one or the other. And there's really no reason to not have one or the other, because then you're left and exposed to a 20% co-insurance for all of your services. And that can be 20% of a small number or a large number, because Medicare is going to cover, Part B is going to cover 80, you're left with 20. So what we try to do, and what we encourage all of our clients to do with our agents throughout South Carolina, is to really sit down and find the decision that makes the most sense for you and your family. If you're on a little bit more of a limited budget and a monthly premium is going to really not be an easy thing to make with a Medicare supplement, the Medicare Advantage might make sense. If you're retiring, coming out of a group plan where you used to paying a lot to have you and your spouse covered, you don't want to worry about copays, you don't want to worry about networks, you just want to pay a monthly bill and live peacefully, a Medicare supplement may work for you. There's no wrong decision. It's just a matter of what decision needs to be made to tailor to the plan that meets a specific client.
Yeah, it's not a one size fits all scenario. That's what I'm hearing.
It's not, and I'll tell you the one thing, Andrew, that we talk a lot about is whether it's through our office, or there are a lot of great agents and agencies through South Carolina. But we really suggest working with local agents. And I think it's real important. These national call centers have become very popular. And we ended up, for lack of a better way to express it, cleaning up a lot of bad decisions that are made because somebody sees a commercial on TV, they call a number, they speak to someone sitting in a call center in another state that knows very little about that person, their needs, their budget, and they get enrolled in a plan that's probably not suitable for them. And then they realize their doctor's not being covered, the prescription drugs are not covered. So whether it's through Lourie Life and Health or you're a local insurance agent, we really recommend people on Medicare sit down or on the telephone, because this can be done on the telephone just as easy, and work with somebody you know, somebody you trust, and somebody who's going to be there throughout the year to answer questions. Because, it's not just let me enroll in my plan and be done. Somebody may have a question throughout the year. A bill comes through that doesn't look right, that wasn't billed properly. I might be wanting to go find a dentist. Can you help me find a dentist in a certain network? So those are the things a local agent can help you with that in many cases a call center cannot help you with.
Yeah, absolutely. And Joe, we deal with a lot of family members that call looking for help with maybe their aunt or their mother or father that's a senior and maybe needs some help. Is it a good idea to bring that family member along with you to these appointments or over the phone so that the family understands what coverages are available and what is covered to help that senior through the process?
Yeah, it's a great idea, Andrew, and it really just depends on how comfortable the client is in making decisions for themselves. And obviously, as people get older, they may depend on a family member or a friend. I walked in an appointment yesterday. One of our agent professionals was meeting with a client, and she had the daughter and the sister there. Okay. And I mean, it was three of them, and they were asking really good questions. And we love that because, we want to make sure there's no greater joy that we get. I consider what we do a blessing when you can come to work every day and help people. And I'm sure you consider it the same way with what you do at Senior Resources. You know, when you can make a difference in people's lives every day, I don't consider that work. I consider that a blessing. Okay. Because it really is, there's no better feeling than seeing somebody leave, knowing that you've solved a dilemma for them that they couldn't figure out on their own. And they're going to go into the next year with benefits that they understand.
Yeah, absolutely. And you know, that's really the critical thing. And to know the timing is critical. And is it December 7th is what the period is, right? So
yeah, October 15th to December 7th. Right.
That's right. Getting these meetings in before December 7th are very important. There's certainly going to be commercials all over the 7 o'clock news and a lot of information going out here in the next few weeks. But just so thankful to have you, Joel, on this to provide some good, reliable local advice to our community on how to handle this Medicare time. Just certainly appreciate you jumping in. Tell our viewers how they can get more information about Lourie Life and Health.
Sure. They can call the easiest thing to do is just call our local number, 803-256-2067. We do have numbers, you know, that are local in Myrtle Beach and Greenville and Charleston, but 803-256-2067. It all comes to the Columbia office, or they can go to our website. It's Lourie, my last name, Lourie, LourieLifeandHealth.com. And Andrew, the only other piece of advice I would give is if you're used to watching television or the news while you eat your dinner, be careful, because one of my commercials may come up and I don't want anyone to lose their appetite.
This thing should come with a warning, Joel, for sure. I was definitely startled on I-26 this morning when I saw the billboard there staring me at the face. But
yeah, that's a lot to take in early in the morning, right?
I almost spit the coffee out on the windshield. So it was a tough start to a Wednesday morning. But Joel, thank you so much for all you do for Senior Resources and for our community. Anybody who needs more information, check in at seniorresourcesinc.org is our website, or look at us on Facebook for more great information on Medicare, but also our library of resources from the Senior Network over the last year that Lourie Life and Health has had us present. And we're just really thankful to have that library of resources for all of our seniors in the community. And if you want more products like this, more information and educational virtual content, please comment, like, share, send us some feedback on what you would like to hear from. Joel did a great job today. We'd love to be able to present this more often, but we want to hear from you. Is this something that's valuable? Did it help you and your family? Really helps us understand what we need to be doing to help our community. So please give us some feedback, like, share this with your family and friends that could benefit, and hopefully we'll be able to bring some more content like this to you in the future. Joel, anything else you want to tell our viewers before we sign off?
No, thank you for letting us partner with you and your great team. We've had the chance to meet so many people over there. Y'all do such a great job that, again, we just appreciate the opportunity to come on and talk a little bit about this, and look forward to other programming with the Senior Network that we can assist you with.
Awesome. Well, thank you very much, Joel. Good luck on this busy season at your office, and good luck to all of our viewers out there that are navigating through Medicare. Until next time, this is Andrew Boozer with the Senior Network. Take care.